Hello, my name is B WALLIS. I am a rising senior biochemistry and molecular biology major at Otterbein University in Columbus, Ohio. My focus is pre-medicine, my minors are in chemistry and psychology, and my passions are in global health and pediatric orthopedics. That being said, when I was asked to formulate an honors thesis project, I decided to travel halfway across the globe. Greetings from Malawi. I am currently located at B International Hospital, which is specific to treat pediatric orthopedic conditions. It's the only orthopedic hospital in the country. So my research is on determining the socioeconomic and treatment factors that can be predicative that a child with a congenital orthopedic condition would present late for treatment here. So we chose to refine it to only congenital conditions so that we would have a more clear-cut window of exactly what late presentation looks like. For other conditions, it's hard to pinpoint exactly when onset was, but if we use the congenital conditions or conditions that were present at birth, then it's much easier to have a very specific date on how late is late. So to give you some background on why I'm so passionate about this and why I think it's so important, clubfoot is the most common congenital condition that we interview patients with here at the hospital. So there's a prevalence of 2 in every 1,000 children in Malawi that are diagnosed with clubfoot, and that's one of the highest statistics worldwide. It's double that of the United States. And you can walk in the markets just down the street, and you can see adults selling their groceries, various fruits and vegetables, or their arts, and they have severe clubfoot that's been neglected their entire lives. So knowing the privilege that we come from to have such great access to medical care, I want to do something to help the people of Malawi determine what are the barriers to them getting access to proper medical care. So we do an interview with the caregiver of the patient. We ask them for the gender, the birthday, and the age of our patients. We have to ask for the birthday because often they're incorrect on the age. But we also ask the relationship and the age with the caregiver. Then we ask them about their address. So not just the district that they live in, but the distance that they live from the main road. They don't have street numbers here. So that leads into my following question. We asked them about transportation. So the distance that they live from the main road is important because the main mode of transportation here in Malawi they're called minibuses. It's public transportation, but they only run on the main roads, and there's only a couple of them. So the distance that you live from this main road is important because you may have to walk, bike, motorbike, or take an ox cart to get to these minibuses in order to make it all the way to this hospital. Then we ask about the caregiver's occupation and their spouse's occupation if applicable. We ask about the highest level of education that they've received and the age they completed it, because often, someone could complete 5th grade at 10 years old, or someone could complete 5th grade at 17 here. And we want to know how long it's been since they've had some kind of academic exposure. We think that this could be an important factor in late presentation. So we also make note of the literacy and the languages spoken by the caregiver. We ask about the average household income. This is sometimes difficult. We ask per month. But it varies based on the month, especially for farmers or self-made business people. Some months they might not get any money, and some months they might get $80 in a single month, which is a lot for Malawian standards. But we ask them for an average or rough estimate on what they think they would bring in a single month. So we also ask about their religion and whether or not their religion prevents them from seeking medical care. Here at the hospital, it rarely happens because if they're here, then their religion probably doesn't prevent it. But our physicians actually go out, they call them mobile clinics. They go out to the rural areas and provide treatment and diagnose patients that may never get the chance to visit any hospital, let alone Beit Cure. And these are the people that we would really target with their religious beliefs, because the witchcraft is not that uncommon, and some people believe that their children are just cursed and that's why they have these deformities. We also ask about their beliefs in traditional healers and their how local or how accessible these healers are to them. We ask about the caregiver's health So HIV, AIDS, hypertension, cancer, diabetes. And then we ask them to rate their health on a scale of 1 to 10. So oftentimes we'll get people that want to lie about their health condition, so we use this rating scale to try and mitigate how many errors that we have. And then we ask about any previous treatment that the child has received. So maybe they've been treated at this hospital before or another clinic and they had a negative experience, or for some reason they had to cease coming. So we want to make sure it's not relapse, that it actually is late presentation. And then we ask about the caregiver's previous knowledge of their child's condition. So if they are unaware, clubfoot, for example, if they're unaware that clubfoot exists and it's treatable, maybe they think that they've done something wrong and there's nothing that they can do to fix it. Then we ask, this is kind of related as well, we ask whether or not the child was born at home or at the hospital, because oftentimes if the baby's born at a hospital, it's recognized and they explain to mom that it is treatable and that they should seek treatment. And then finally, we ask the caregiver about their personal opinion on why or why not their child presented late for care. So we get a kind of qualitative, holistic view of the child's life and the people that surround them, so we can understand better why it took them so long to appear here. Or why not it took them so long to appear here. So we are currently expanding our project to the other 3 to 4 clinics across Malawi that have the capability of treating clubfoot. Any other condition, the only place they can treat them is Bay-Cure. So the other clinics will have access to our database and be able to input things from the interviews that they conduct. And then in 2.5 weeks, I'm actually traveling to Kenya to train the nurses on how to use our database and how to perform our interviews so that we can have a comparative study between the two cure locations. So we're all very excited to see the results and to see, what we can do with the information to try to help the children of Malawi. Thank you.